Welcome to our series on debunking myths of mental illness. Today's topic is medication is all a ploy by the drug industry to screw you up and take your money. So I am Dr. Wendy Rice, and I am a licensed psychologist in Tampa, Florida, and I run the Rice Psychology Group. So glad that you joined us for today. Before I even begin this video, I need to tell you that I'm not a psychiatrist. I do not prescribe medication. However, I work in the mental health industry, and I really appreciate the role that medication can sometimes play in helping people to feel better. So I don't prescribe. I don't have a stake in this game exactly. I just appreciate the value. So I personally have seen how medication can help turn somebody's life around. And I see a lot of people with depression and anxiety where their brains just don't allow them to experience good feelings, even if they're there, or their brains don't allow them to shut off the recurring negative thoughts. And a little bit of an antidepressant, which is a little bit of medication that just alters the neurotransmitters that are allowed to hang out in their brains a little bit, can remarkably help people to feel better and get to a level of being able to function. They aren't supposed to make you into a zombie. They aren't supposed to dull you in any way. You shouldn't feel anything. It's almost like wearing contact lenses, and that's kind of what we're looking for. Or a Band-Aid. You know, you feel it when you put it on and you don't feel it after that. If you're really having too much more of an impact than that, then you need to go back to your medical professional, your psychiatrist, or your primary care in order to get your medication adjusted. Another place where I've seen medication be very, very helpful, and I believe it needs to be on the very top of the list, is when you're dealing with attention deficit hyperactivity disorder, whether or not you're hyperactive. Literally, when you have ADHD, your brain just can't screen out distractions and it doesn't regulate very well. And so what medication can do is give you the chance to put on the brakes, stop, and focus on what's important. And there's no therapy that I can offer or anybody can offer really that can match what medication can do when you have an ADD or ADHD brain. If you're a person who flies off the handle a lot and freaks out and feels paranoid and your thinking gets confused, again, there's a lot we can do in therapy, but sometimes you need a little bit of medication to make therapy possible and to almost help the person to calm down enough and their thoughts and their feelings enough to be receptive. So again, today's myth is that I don't believe that medication for psychiatric and neurodevelopmental problems is a ploy by the drug company to take your money and screw you up. I do believe that people need a good evaluation and they really need to understand what's going on before medication is implemented. And for all mental health problems, a combination of therapy and medication is so important. So if you're looking for help with that, you can reach us on the web. You can reach us through social media channels at ricepsychology.com. And I just want to thank you so much for joining us today. We'll see you soon.